There's something most doctors won't tell you about reflux, not because they're hiding it, but because it seems so innocent, so harmless, that even medical professionals often overlook it. And today, I'm breaking that silence. I'm Dr. Michael Hayes, board-certified gastroenterologist with 23 years of experience treating digestive disorders, and what I'm about to reveal will probably shock you because this seemingly healthy habit that millions of Americans practice every single day is silently destroying their esophagus and dramatically worsening their reflux symptoms. Just 3 months ago, I had a patient walk into my office, Margaret, a 63-year-old retired teacher from Florida who came in absolutely desperate. She had been dealing with nighttime reflux for nearly 8 years, spending somewhere between $400 and $600 annually on medications, sleeping elevated, avoiding trigger foods, doing everything right according to conventional wisdom, yet her symptoms were getting progressively worse. The burning sensation rising like molten lava would wake her up at 2:30 in the morning almost every single night, and she was beginning to experience a persistent dry cough that worried her tremendously. During our detailed consultation, I asked her to walk me through her entire daily routine, not just her diet, but every single habit, every beverage, every seemingly insignificant choice she made throughout the day. When she mentioned her evening ritual, something clicked immediately. Margaret told me that every single night after dinner, she would make herself a nice cup of peppermint tea because she had read online that peppermint was supposed to soothe digestive issues and help her relax before bed. She thought she was doing something beneficial for her health. She had no idea that this innocent habit was the primary reason her reflux had become unbearable despite all her other efforts. This is educational content only, not medical advice, and everything I share today is meant to complement, not replace, professional medical care. The information I'm providing is based on current medical understanding and clinical experience, but individual results may vary significantly, and you should always consult your healthcare provider before making any changes to your treatment plan. What Margaret didn't know, what most people don't realize, is that certain foods and beverages that are marketed as healthy or soothing can actually be the worst possible choices for anyone suffering from acid reflux or gastroesophageal reflux disease. The food and beverage industry, health blogs, and even well-meaning friends perpetuate myths about what helps digestive issues. And these myths are costing people their quality of life and potentially their long-term esophageal health. Over my 2 decades treating thousands of reflux patients, I've identified 3 major myths that keep people trapped in a cycle of worsening symptoms despite their best efforts. And today, I'm going to expose each one of these myths, explain the science behind why they're dangerous, and then give you the complete protocol for actually addressing the root causes of your reflux. The patient details I share have been changed to protect privacy and in some cases represent composite examples drawn from multiple similar cases I've encountered in my practice. The first myth I need to destroy immediately is the belief that mint products, specifically peppermint and spearmint, are beneficial for digestive health and reflux symptoms. This myth is everywhere. Walk into any health food store and you'll find peppermint tea marketed for digestive comfort. Search online for natural reflux remedies and peppermint appears on countless lists. The reality is exactly the opposite, and the mechanism is actually quite simple once you understand the anatomy. Your lower esophageal sphincter, which I'll call the LES, is a ring-shaped muscle located at the junction where your esophagus connects to your stomach. This muscular valve is supposed to remain tightly closed except when you're swallowing food or liquid, creating a one-way passage that allows food down but prevents stomach acid from flowing back up into your esophagus. When this sphincter is functioning properly, it maintains enough pressure to keep gastric contents exactly where they belong. Here's where peppermint becomes the enemy. The menthol compounds in peppermint and spearmint have a direct relaxing effect on smooth muscle tissue throughout your digestive tract. While this relaxation might help with certain digestive issues like intestinal cramping lower in the gut, when it affects the lower esophageal sphincter, it's absolutely catastrophic for reflux sufferers. Studies have demonstrated that peppermint oil can reduce LES pressure by as much as 20 to 40% within just 15 to 30 minutes of consumption. Imagine you have a door that's supposed to stay firmly closed to keep water from flooding into your house. Now imagine someone comes along and loosens the hinges and weakens the door frame. That's essentially what mint does to your esophageal sphincter. Margaret was consuming peppermint tea every single evening, typically around 8 or 8:30 at night, which meant that by the time she went to bed around 10:30 or 11 o'clock, her LES was significantly relaxed and weakened. Then, when she laid down horizontally, gravity was no longer helping keep acid in her stomach, and with a weakened sphincter, acid was free to flow upward throughout the night. This wasn't just causing her nighttime symptoms. The chronic exposure to acid was beginning to damage the delicate lining of her esophagus. When I explained this mechanism to her, she was stunned. She had been unknowingly sabotaging herself for years, all because she trusted marketing claims and unverified online advice. The food industry loves mint because it's cheap, it's refreshing, and consumers associate it with freshness and digestive health. What they don't tell you is that for anyone with a compromised LES or existing reflux issues, mint products are essentially acid reflux in a cup. This includes not just tea, but also mint-flavored gum, breath mints, mint chocolate, mojitos, mint-flavored toothpaste used right before bed, anything containing significant amounts of menthol or mint oils. Join the thousands of people who have already subscribed and transformed their digestive health by hitting that subscribe button now, because this community is growing and you don't want to be left behind with outdated information. The second myth that's destroying people's esophageal health is the idea that if a food is healthy in general, it must be safe for reflux. This is dangerously wrong. Some of the healthiest foods on the planet are terrible choices for people with gastroesophageal reflux disease, and citrus fruits are the perfect example. Oranges, grapefruits, lemons, limes, even tomatoes, which are technically fruits, these are packed with vitamins, antioxidants, and beneficial nutrients. They're associated with reduced cancer risk, better immune function, and improved cardiovascular health in the general population. But for someone with reflux, they're essentially drinking acid and wondering why their throat burns. The issue is the high acid content. Orange juice typically has a pH between 3.3 and 4.2, which is highly acidic. Your stomach can handle this level of acidity because it's designed for it, with a thick protective mucus layer and cells that constantly regenerate. Your esophagus has no such protection. The esophageal lining is delicate squamous epithelium designed for the passage of food, not for bathing in acid. When you consume highly acidic foods and beverages, you're not just introducing stomach acid into the equation, you're adding additional acid to the mix. Even if your LES was functioning perfectly, you're increasing the total acid load that could potentially reflux. And here's what most people don't realize. It's not just about the immediate burning sensation. Repeated exposure to acid, even if it doesn't cause severe pain every single time, creates chronic inflammation in the esophageal tissue. This inflammation can progress through several stages. First, you get simple irritation and redness. Then, over months or years of repeated exposure, the tissue starts to develop changes. The cells begin to adapt, and in some cases, they undergo a transformation called intestinal metaplasia, where the esophageal cells start to resemble intestinal cells in an attempt to protect themselves from the acid. This condition is called Barrett's esophagus, and it significantly increases your risk of developing esophageal adenocarcinoma, a type of cancer that has seen a dramatic rise in incidence over the past 4 decades in the United States. I had a patient, Robert, 47 years old, who was a health enthusiast. Every single morning, he would start his day with a large glass of fresh squeezed orange juice because he believed it was boosting his immune system and providing essential vitamin C. He also had a habit of drinking lemon water throughout the day because he'd read it was alkalizing and good for digestion, despite the fact that lemon juice itself is highly acidic with a pH around 2. Robert came to me complaining of morning hoarseness and a chronic cough that his primary care physician couldn't explain. When I performed an upper endoscopy, I found significant inflammation throughout his lower esophagus and early signs of Barrett's esophagus at age 47. He was absolutely shocked because he thought he was making healthy choices. The third myth that keeps people suffering unnecessarily is the belief that timing doesn't matter as long as you're eating the right foods. This is catastrophically wrong, and it's one of the easiest things to fix once you understand the physiology. Your stomach is not an instant processing machine. When you eat a meal, depending on the composition and size, it can take anywhere from 2 to 6 hours for your stomach to empty its contents into your small intestine. During this entire time, your stomach is producing acid to break down the food, and the gastric contents are churning and mixing. If you eat dinner at 7:30 in the evening and then go to bed at 10 o'clock, you're lying down with a stomach full of partially digested food and acid. Gravity is one of your most important allies in preventing reflux. When you're upright, gravity helps keep gastric contents down in the stomach where they belong. The angle of the gastroesophageal junction naturally creates a slight barrier. When you lie flat, you eliminate this gravitational advantage entirely, and if your stomach is still actively digesting food, the risk of reflux increases exponentially. This is especially true if you're a side sleeper or back sleeper without proper elevation. I've seen countless patients who eat relatively healthy dinners, avoid most trigger foods, but they eat late and go to bed too soon afterward, and they cannot figure out why they're waking up choking on acid at 1 or 2 in the morning. The answer is simple. Timing matters just as much as content. Your body needs adequate time in an upright position after eating to allow gravity to assist in keeping food and acid in the stomach while initial digestion occurs. The general recommendation is to avoid eating within 3 to 4 hours before bed, but many people find this inconvenient or impractical given modern work schedules and family dinner times. That's understandable, but if you're serious about controlling reflux, this is non-negotiable. Comment below and tell me, how long have you been dealing with nighttime reflux? I read every single comment and I want to hear your story. Now let me explain the actual science of what's happening inside your body and why these myths are so dangerous when you understand the complete picture. Your digestive system is an incredibly complex series of specialized organs, each designed for specific functions, and the transition zone between your esophagus and stomach is one of the most critical junctions in your entire body. The esophagus is approximately 10 inches long in most adults, a muscular tube that propels food downward through coordinated wave-like contractions called peristalsis. At the bottom of your esophagus, right where it connects to your stomach, you have the lower esophageal sphincter, which is not a distinct anatomical structure you could easily identify in surgery, but rather a functional zone of increased muscle tone in the lowest 1 to 2 inches of the esophageal muscle. In a healthy individual, this sphincter maintains a resting pressure of about 10 to 30 millimeters of mercury, which is enough to prevent reflux while still allowing food to pass through when you swallow. Your stomach is positioned primarily on the left side of your abdominal cavity, and the esophagus connects to the stomach at the upper left portion, creating what's called the gastroesophageal junction. This anatomical arrangement is actually one reason why sleeping on your left side can be beneficial for reflux, because it positions the junction higher than the main body of the stomach, allowing gravity to help keep acid away from the sphincter. The stomach itself is an expandable sac that serves multiple functions. It stores food so you don't have to eat constantly, it churns and mixes food with gastric secretions, and it begins the chemical breakdown of proteins through the action of pepsin and hydrochloric acid. Your stomach lining is remarkably adapted to this harsh, acidic environment, with a pH that can drop as low as 1.5 to 2 during active digestion. This is comparable to battery acid in terms of acidity. The stomach achieves this through parietal cells that secrete hydrochloric acid and chief cells that produce pepsinogen, which becomes active pepsin in the acidic environment. To protect itself, the stomach produces a thick layer of mucus and bicarbonate that creates a neutral zone right against the tissue, and the stomach lining regenerates completely every 3 to 5 days, constantly replacing damaged cells. Your esophagus has none of these protections. The esophageal lining is thin, delicate squamous epithelium designed only for the passage of food and liquid. When acid from the stomach flows backward into the esophagus, which is what we call gastroesophageal reflux, the esophageal tissue is exposed to an environment it was never designed to handle. A single episode of reflux might cause temporary burning and discomfort, but no lasting damage. However, when reflux occurs repeatedly, especially during sleep when saliva production decreases and you're not swallowing to clear the acid, the cumulative damage begins to add up. Initially, you get inflammation, which you might feel as burning or chest pain. If the reflux continues chronically over months and years, the tissue can develop erosions, which are like superficial ulcers in the esophageal lining. In some cases, these erosions can become deep enough to cause bleeding, which might appear as blood and vomit or black tarry stools. More concerning is the long-term adaptive response, where the esophageal cells undergo metaplastic changes, transforming into a type of cell that's more resistant to acid but also precancerous. This is Barrett's esophagus, and while not everyone with Barrett's will develop cancer, it increases your risk by 30 to 40 times compared to the general population. The progression from chronic reflux to Barrett's to esophageal adenocarcinoma can take decades, but each year of uncontrolled reflux increases that risk incrementally. What makes this particularly insidious is that many people have reflux without obvious symptoms, a condition called silent reflux or laryngopharyngeal reflux, where acid reaches the throat and voice box but doesn't cause the classic heartburn sensation. These individuals might only notice chronic hoarseness, persistent throat clearing, chronic cough, or a feeling of something stuck in their throat, and they may have no idea they're developing esophageal damage until it's caught on endoscopy or they develop more severe complications. So what's the complete solution? How do you actually address this problem comprehensively instead of just treating symptoms? I'm going to give you a 4-step protocol that addresses the root mechanisms of reflux, and if you implement all 4 steps consistently, the majority of people will see dramatic improvement within 2 to 4 weeks. Step 1 is dinner timing, and this is absolutely non-negotiable if you're serious about fixing this problem. You must stop eating at least 3 to 4 hours before you plan to lie down to sleep. I understand this is inconvenient for many people, especially if you work late or have family obligations that result in late dinners, but the physiology doesn't care about your schedule. If you typically go to bed at 10:30 at night, your last meal should be finished no later than 6:30 or 7 in the evening. If you work a night shift and sleep during the day, adjust accordingly based on your sleep schedule. This timing allows your stomach adequate time to empty the majority of its contents into your small intestine before you assume a horizontal position. For most mixed meals containing protein, carbohydrates, and some fat, gastric emptying takes approximately 3 to 4 hours. High-fat meals can take even longer, up to 5 or 6 hours, which is another reason to minimize fat intake at dinner if you suffer from reflux. If you absolutely must eat something closer to bedtime due to hunger or blood sugar management issues, choose a very small amount of a low reflux food like a plain banana, a small handful of almonds, or a few crackers, something that will take minimal time to digest and won't stimulate significant acid production. But ideally, plan your eating window so that you complete dinner early enough to allow adequate digestion time before sleep. Step 2 is bed elevation, and I'm not talking about propping your head up with a couple of pillows. Regular pillows create a bend at your waist that actually increases intra-abdominal pressure and can worsen reflux. What you need is elevation of your entire upper body, from your waist to your head, creating an incline of approximately 6 to 8 inches. The easiest way to achieve this is by placing blocks or risers under the legs at the head of your bed, elevating the entire sleeping surface. You can purchase bed risers at most home goods stores for $20 to $40, or you can use sturdy blocks or even hardcover books if you need a temporary solution. Alternatively, you can use a foam wedge pillow designed specifically for reflux, which typically costs between $50 and $150 depending on size and quality. The elevation uses gravity to help keep acid in your stomach even when you're lying down. Even a relatively small incline makes a significant difference in reducing the frequency and severity of reflux episodes during sleep. This is one of the most effective non-pharmacological interventions available, with studies showing that proper bed elevation can reduce nighttime reflux episodes by up to 60 to 70% in many patients. Step 3 is left side sleeping position. The anatomy of your stomach and esophagus makes sleeping position critically important. Your stomach is positioned primarily on the left side of your body, and the esophagus connects to the upper left portion of your stomach. When you sleep on your left side, the gastroesophageal junction is positioned higher than the main body of the stomach, allowing gravity to keep acid away from the sphincter. Additionally, the natural curve of the stomach means that when you're on your left side, acid tends to pool in the main body of the stomach rather than at the junction. Contrast this with right side sleeping, where the junction is now at the lowest point and acid naturally pools exactly where you don't want it, right at the entrance to your esophagus. Multiple studies have confirmed that left side sleeping significantly reduces reflux episodes compared to right side or back sleeping. To maintain left side position throughout the night, you can use a body pillow to prevent rolling, or place a pillow behind your back as a barrier. Some people find it helpful to place a small pillow between their knees to make side sleeping more comfortable. It may feel awkward for the first few nights if you're used to sleeping in a different position, but most people adapt within a week or two. Step 4 is eliminating the actual trigger substances that are weakening your lower esophageal sphincter or increasing acid production. This means completely removing mint products from your diet. No peppermint tea, no spearmint gum, no mint chocolate, no mojitos, no mint in any form. Switch to a non-mint toothpaste if you're using mint toothpaste right before bed. Eliminate or dramatically reduce citrus consumption. No orange juice, no grapefruit, no lemon water, minimal tomatoes and tomato-based products. Avoid chocolate, which contains methylxanthines that relax the LES, similar to mint. Eliminate caffeine or restrict it to morning hours only, as caffeine relaxes the LES and increases acid production. Avoid alcohol, especially in the evening, as it both relaxes the sphincter and irritates the esophageal lining. Cut out carbonated beverages entirely, as the bubbles increase gastric pressure and promote reflux. Reduce high-fat foods, particularly at dinner, as fat slows gastric emptying and relaxes the LES. Avoid spicy foods if they trigger your symptoms, though the evidence on spices is somewhat mixed and individual. Focus instead on lean proteins like chicken, fish, or turkey, complex carbohydrates like oatmeal, rice, and whole grains, non-citrus fruits like bananas, melons, and apples, green vegetables like broccoli, green beans, and asparagus, and healthy preparation methods like baking, grilling, or steaming rather than frying. You need to understand the warning signs that indicate your reflux has progressed beyond simple heartburn and requires immediate medical attention. Seek immediate medical attention if you experience severe chest pain that radiates to your arm, jaw, or back, as this could indicate a heart attack rather than reflux. Call 911 immediately if you have chest pain with sweating, shortness of breath, or pain radiating down your arm. If you have difficulty swallowing solids or liquids that progressively worsens, this could indicate stricture formation or even esophageal cancer and requires urgent evaluation. If you vomit blood or material that looks like coffee grounds, this indicates bleeding in your upper digestive tract and is a medical emergency. If you notice black, tarry, or bloody stools, this also suggests upper gastrointestinal bleeding. If you experience unexplained weight loss of more than 10 pounds without trying, especially accompanied by difficulty swallowing or persistent reflux, this is a red flag for possible malignancy. If you have persistent heartburn despite medication and lifestyle changes lasting more than 2 weeks, you need to see a gastroenterologist for evaluation. If you develop a chronic cough with blood or severe shortness of breath, seek immediate care. If you have hoarseness lasting more than 2 weeks that doesn't respond to voice rest, this could indicate chronic reflux affecting your larynx or other serious conditions. If you experience pain when swallowing accompanied by fever, this could indicate an infection or other serious problem. If you have choking episodes during sleep that are frequent or severe, this requires medical evaluation as it could indicate severe reflux or sleep apnea. This is educational content meant to complement, not replace, professional medical care, and individual results may vary significantly based on your specific medical situation. Listen, if this information was valuable, you have the power to change someone's life right now. Like this video so more people find it. Subscribe so you don't miss the follow-up content. Share it with someone who needs it. And comment so I know this is resonating. Those 4 actions take less than 30 seconds but could save someone from years of suffering.